We want to explain one of the things that we do a little differently here at Dermetics. We blend Bo-toxins.
You see, Bo-tox, like Kleenex, is the most well-known and used brand, but it's not the only one in its class of medications called neuromodulators. There are other Bo-toxes approved in Canada, including Dysport, Nuceiva, and Muhn. They're all slightly different from each other in terms of their manufacturing process, but they all share at their core the same active ingredient called botulinum toxin type A.
Now, to illustrate this concept, pretend that this delicious green peanut M&M is Bo-tox. At its core is botulinum toxin type A, the peanut. The chocolate and green candy coating are part of the manufacturing process. But the peanut is why we get the desired clinical effect. Dysport and Nuceiva have their own proprietary chocolate and candy coatings, whereas Muhn is the pure, naked peanut in the jar. Interesting fact, all the companies that make these products shop at the same exact peanut farm for their active ingredient, botulinum toxin type A.
And when any of these are injected into the skin to treat unwanted expression lines, all of the toxins create a similar clinical effect. That is, temporarily weakening the muscles. The manufacturing process, however, has led to slight differences in how these different brands perform clinically in our experience. And experiments have shown that one key way in which the toxins perform differently is in the way that they diffuse after their injection or spread from the point of injection. In this manner, there's an impact on how specific or generalized the effect will be, an important consideration since our eyebrows, they float on our skin in a tug of war between the muscles that lift them and make forehead lines and the muscles that pull them down and make frown lines and lines around the eyes. The muscles that raise our brows are big, broad bands of muscles, whereas the frown muscles are itty-bitty thin strips of muscle that immediately neighbor the forehead muscles. So in order for us to be able to beautifully shape the brows with Bo-tox, we often need to be very precise in those thin muscles, but like a more generalized spread and effect in the forehead muscles, for example.
Now, another difference between toxins is something that we call potency. It may take slightly different volumes or proprietary units to achieve the same level of effect or duration of effect with the different toxins. So we might need 10 units of one or 108 units of another and 11 units of a third to get the same inhibition of muscle contraction and duration of effect. Finally, having more coatings on the peanut can potentially make the medicine more apparent to our immune system, which doesn't take kindly to invaders. This means that antibodies may form over time, and repeated exposure or treatments eventually leading to resistance down the road to the effect of the medication. Now, it's unclear at this time how significant a risk this is, but some of our colleagues in Asia have started to report this lately. This is likely based on their type of dosing, the amount of dosing they use, and the way the treatments are done there compared to what we do here. Curiously, many of the manufacturers are working on newer versions of their own toxins that are also naked peanuts. That is, they're produced and delivered in liquid instead of the current powdered form and don't have their proprietary coatings attached anymore, just the peanut, swimming in this little bath.
We have used all the different brands approved in Canada, and we've even done clinical trials on several other brands that will eventually be coming to market in Canada, some of them in the very near future. And as we've become aware of the nuances and clinical effect in our hands, this has led us to choose different neuromodulators for different muscles in most of our patients. This way, we're able to take advantage of more precision where it's needed and more diffusion where it is an advantage based on individual patient goals and anatomy. We also try to limit the amount of targets for the immune system where we can, without compromising clinical effect. And at Dermetics, we always feel that elevated results are all about the details.
Either way, you get a delicious snack or a wonderful clinical effect. But sometimes you just want a peanut, and other times you want a green M&M. We hope this was informative for you, and thank you for watching. Come on over to Dermetics and let us find the right blend for you.